About your project and why you decided to go forward with it.
Standard question. Yeah. So our project is dealing with, we like to work with immigrant and refugee populations here in St. Louis. So in light of the new Affordable Care Act and the insurance exchanges that are going to start in October, we'd like to really start getting immigrants and refugees enrolled in those insurance exchanges so that they can have access to preventative health care services and all the other plentiful services that are available as well.
And how has it developed so far since you decided to go forward with it?
We're still in the very early stages of it. We are trying to form community partnerships right now. So we've had a few meetings with organizations like Orange Jewish, who have a pretty robust diversity program that goes and reaches out into specific immigrant communities here in St. Louis. So we had a few meetings with them. We're trying to get in contact with the International Institute here in St. Louis. So it's definitely right now in the stages of forming partnerships and seeing where the need really is in the immigrant communities.
Now obviously, a couple of decades ago, there was an influx of Bosnians in St. Louis. Are there still refugees coming here in large numbers? And if so, who's coming here?
Yeah, right now, primarily people from Bhutan and Burma are resettling here. There are still some Afghan refugees resettling here as well, so Eritreans.
Why do you think they come to St. Louis? Because of the International Institute? That's usually been cited as a reason.
So what happens is when refugees are resettled, the federal government or a federal government organization gets word that they're coming to the United States, and then they kind of disperse them throughout the United States. So they don't get to choose where they go, but they get resettled in different cities.
So the Clinton Global Initiative, I guess there's still a couple hours left, and there's tomorrow as well. How has it benefited your project, and what have you learned from it for how to go forward?
I think making connections with other students that have CGI commitments has been really invaluable. There are a lot of people that are maybe not doing exactly what we're doing, but are working with similar populations or maybe have connections that we haven't looked at. So exchanging ideas and really talking through the process of carrying out commitments has been really, really helpful to me.
For me, I feel very challenged. I see groups that are in the middle of their projects, whereas we are very much at the beginning. And so for me, it's kind of like a call to action, seeing people stand up there and talk about what they have done from last year or what they've already started for this year. So that's definitely, I mean, I'm ready to get going.
So you mentioned it's early on. When did you guys decide to start this?
We started last fall. We started talking about it, I think, in October, November, and we actually submitted our application in December.
Okay.
So, yeah. And originally the project was based around the new preventative services that are available for women specifically. And so women as a subset of the immigrant refugee population is obviously a very vulnerable population. And so that's how it started. But if they don't have insurance, they can't access those preventative services. So that's why we had to take a step back.
If you had one suggestion for people who are embarking on an endeavor, maybe not similar in cause, but similar ideas, what sort of advice would you give, and what pitfalls or challenges should they expect if they decide to, help out in their community like you guys are doing?
I think from the session yesterday, I really took away the message of don't stop. You're going to stumble, you're going to fall, you're going to have people think you're crazy, but to just keep going and pushing through, and if you have that vision, do whatever it takes to carry it out.
And believe in yourself and know that you can actually go forward with it. If you think that you can do it, you really can. So keep going. And find people that are passionate about similar issues and can reframe your own perspective and collectively make a vision a reality.